It is not only livestock that can transmit zoonotic diseases. Companion animals that you have on your farm, including cats, horses, and even camelids, can too. There are 4 zoonotic diseases that are prevalent, and we will break them up by how humans are able to get these diseases. The first 2 diseases are transmitted through a direct contact. This means that you have to have skin-to-skin contact with the infected animal or the infected surfaces for people to become infected. The first direct contact disease we will talk about is ringworm. Ringworm is a fungal infection. There are many different types of funguses that can cause ringworm. Symptoms in cats can be seen as a scaly white lesion with hair loss. In humans, ringworm can look like small bumps on the skin that can cause hair to become brittle and cause bald patches in infected areas. Treatment for ringworm will be a topical antifungal cream prescribed by your veterinarian or your physician. The next disease that is also direct contact is hookworms. Hookworms is transmitted when an animal will shed the eggs of the worm onto the soil from their stool. Their stool will infect the soil with the hookworms, and when people walk over the infected area, they will pick up the infection themselves with the hookworm. Symptoms in cats can be seen as a scaly white lesion with hair loss, anemia, blood in their stool, a poor-looking coat, and weight loss. In humans, hookworms can be seen as an itchy red rash on the skin. Treatment for both humans and cats will be an antibiotic treatment. The first disease we'll talk about is Campylobacter. Campylobacter is a common cause of diarrhea in kittens. It is a common bacteria that will cause gastrointestinal disease in humans. Symptoms of Campylobacter in cats include bloody mucus discharge, diarrhea, or they could show no signs of infection. Symptoms in humans can include diarrhea, fever, stomach cramps. To treat Campylobacter in animals, a veterinarian can prescribe antibiotics to help fight the infection. And for humans, they can make sure that they're getting plenty of rest and fluids. Usually, not a lot is used to treat Campylobacter in humans, and it will resolve itself on its own. The next disease is Salmonella, usually thought of with undercooked meat, but you can get it just as easily with live animals. Salmonella is a bacterial disease caused by a bacteria. There are many strains of Salmonella. Symptoms in cats can include diarrhea, sometimes with blood or mucus, lethargy, fever, vomiting, decreased appetite, and excess salivation. Symptoms in humans may include diarrhea, fever, stomach cramps. The last disease we will cover for cats is toxoplasmosis. Toxoplasmosis is a common protozoan parasite. Cats will rarely show signs of toxoplasmosis, but cats with a weakened immune system may show symptoms of fever, loss of appetite, and lethargy. In humans, common symptoms would be common flu-like symptoms, such as tender lymph nodes and muscle aches, but most healthy people will not notice that they are infected. The parasite can stay in the body for a long period of time, and when the person becomes immunocompromised, it can make the person sick again. If a pregnant person gets infected, then she may pass the infection onto the baby and cause the baby to have eye problems, hydrocephalus, or convulsions. Toxoplasmosis can also cause miscarriages and stillbirths. To treat toxoplasmosis in cats, an antibiotic can be prescribed, and in humans, the treatment will depend on where the infection is present. A physician will seek the best course of treatment. Next, we will move on to diseases that are focused with the equine. The first one we will cover is leptospirosis. Lepto is caused by a bacteria that is spread in the urine of infected animals. Since it is passed through urine, you are able to become infected with lepto by coming in contact with infected water, which can include drinking or swimming or coming in contact with infected soil. Sometimes in humans, symptoms can include high fever, headaches, chills, muscle aches, vomiting, jaundice, red eyes, abdominal pain, diarrhea, and rash. Signs in horses can be depression, fever, loss of appetite. Equine recurrent uveitis, more commonly known as moon blindness, can occur when leptobacteria migrates into the eye, and it causes inflammation of the inner eye, which can lead to blindness in horses, abortions, and in extreme cases, kidney and liver failure. To treat lepto, your doctor or veterinarian can prescribe antibiotics. The next equine disease that we will go over is Salmonella. Salmonella, as we talked in cats, is a bacterial infection. Symptoms can start as soon as 6 hours to 6 days after the infection. Humans may have diarrhea, fever, and stomach cramps. Horses may not show symptoms when infected with salmonella, or they may have a mild case of diarrhea. In a certain type of salmonella, called Salmonella abortisci, this can cause abortion in equines. Treatment for salmonella can include antibiotics, the use of fluids. Lastly, we'll talk about zoonotics and camelids. Camelids are animals such as camels, llamas, and alpacas, and more in this specific species. The first disease we'll go over with camelids is ORF. ORF is a virus that causes a scabby, sore lesion around their lips, muzzle, and mouth of the animals. Lesions can also be seen on udders of infected animals when young are nursing. ORF occurs worldwide and is very common in sheep and goats. Infections can occur when a person has a cut or an abrasion on their hand and comes in contact with the virus. In humans, ORF can be sores on the top layer of skin and could also have mild fever, fatigue, and swelling. Treatment for ORF is nonspecific and will depend on where the infection occurs. Lastly, when we talk about camelids, we will talk a little bit about spitting. While this is not a disease and is usually harmless, it can still affect humans. Camelids spit to assert dominance over one another, and they establish a pecking order this way. Camelids, such as llamas and alpacas, can be used as guard animals, and spitting is one of those defense mechanisms that they use. Females may spit at males if the males are too eager to mate with them. They will also spit during feeding time if there is a need to compete with food. Camelids will spit at other camelids, humans, and animals that they find threatening. Camelids' spit will change depending upon the threat level. When they see animals and they feel mildly threatened, then their spit will only be a mist, made of the spit that is already in their mouth. If the animal has just eaten and feels mildly threatened, there could also be food particles in the spit. If the animal feels very threatened, then they will spray fermented food from their first stomach. While the spit is not very dangerous, it smells very putrid and has a slimy texture. This will ward off predators from 10 feet away. There are some signs that they will show you before they spit. These signs could be pulling their ears back, staring directly at a person or an animal threat, or raising their chin as they will gargle. To prevent them from spitting, you can just be sure that you build trust with your camelid, making sure that they are used to you and other humans, so they do not feel as threatened around other humans. Camelids are pack animals, so having multiple animals can keep them calm and to increase their sense of security. Thanks for watching. If you have any specific concern about zoonotic diseases, reach out to your local extension office and your local veterinarian.